My name's Shamir Mehta. I'm the Senior Clinical Dental Advisor to the General Dental Council. And as was just said a few minutes ago, getting into dentistry is quite challenging. But there are also various other branches within dentistry, which I'll briefly discover. So in today's presentation, I'm just going to give you a brief overview of several things, such as what the General Dental Council is about, other regulated professions within dentistry beyond actually being a dentist, what it means to be a dental professional, a bit about my own career, and hopefully that will cast a slightly different aspersion, certainly on budding future dentists. And then hopefully, if we've got the opportunity, I can take some questions at the end. Can I have the next slide, please? So the General Dental Council is a regulator of the entire dental profession across the UK, and we have approximately 115,000 dental registrants, of which roughly about 60,000 dental nurses and about 42,000 dentists. And then there are various other types of registrants, which I'll explain slightly later on. We are one of the 9 UK regulators with health and care, and I think you've heard from one of our others, one of the other 9, such as the GMC earlier today. And the General Dental Council, covers not only treatment provided under the terms of the NHS, but also dentists providing treatment on a private basis. So we regulate the full spectrum of dentistry or dental work that's carried out. And we work with other partner regulators, such as the CQC and various other organizations, such as the NHS, so on and so forth. So we collaborate with other bodies as well. But as a GDC, we've got 3 overarching functions. And one is the protection of the public, of the health, safety, and well-being, where, really speaking, a lot of the things that we do are looking into patient concerns or public concerns. We maintain public confidence in the dental profession and maintain the standard of the profession. And we also promote and maintain professional standards, which are the standards which we expect dental registrants to comply with, and the conduct of dental professionals as well. So I've given a very overarching view, but there are lots of things that go on at the General Dental Council level. If I could have the next slide, please. So in terms of the various professions, if you like, that the GDC regulates, as I said, and the obvious one is dentists, and the majority of the dentists, or dentally, those who've qualified, having done the BDS or the equivalent, work in primary care and general practice. A small number of dentists will then go ahead to become specialists. And you may have heard of things like orthodontists or oral surgeons or root canal specialists, who then limit their practice often to providing that type of treatment. Some of them may work in the community sector, doing community dentistry, but the majority, as I said, will be in general practice. And now, in the sort of era that we live in, a lot of the dentists within the general practice setting will upskill by doing further postgraduate qualifications, so that they've got additional skills, if you like, which they can use to provide treatment to their patients. The GDC also regulates clinical dental technicians, and these are individuals who are technicians, which I'll discuss a little bit more in a minute, who've done further training, and they provide treatment to patients directly. And there's a limited number of things that they can do, where often, rather than going to see the dentist as a sort of the middle person, they go straight to the technician, who can use their skills and expertise to provide patient care. There are hygienists, which you may have heard of. These are individuals who sort of focus a lot on preventative dentistry and spend a lot of their time practically sort of doing cleaning and oral hygiene advice, etc. And they have a big role to play. You have dental nurses who often assist dentists in the various tasks that they do. And again, they can, after having completed their essential sort of qualifications, do further training and upskill. and some of them may even go on and become hygienists or dentists, etc. But dental technicians who carry out the technical side, where a dentist may prescribe a treatment such as a denture or a crown leg, you could call a cap. So they carry out the technical side. So they don't usually communicate directly with patients. They work on a prescription that we give to them. Then you've got dental therapists who, if you like, most of them are hygienists. They've got added extra training which allows them to do some of the treatments that dentists do under prescription, such as fillings and more simple treatments which a dentist can delegate to them. And then we've got orthodontic therapists, and these are individuals who carry out orthodontic treatment, such as fitting braces, etc. And again, they do that under the prescription or guidance of an orthodontist who advises them what to do. So some of this is information which some of you may not be aware of, but there are lots of different types of registrants that the GDC regulates, and lots of different types of professionals within the overall spectrum. There are obviously other careers in dentistry which don't require the individual to be registered with the GDC, such as practice managers and receptionists, etc. And obviously they play an important role in the dental team as well. So if I could have the next slide, please. So what does it mean to be a dental professional? And again, professionalism is something that is very important. It means, obviously, as a professional, as a dentist, you are registered, or you're registered with the General Dental Council. And that registration has to be maintained. It's an ongoing thing which we renew on an annual basis. And with that, of course, there's an annual registration fee. But what we're also required to do is to keep up with our professional education and do a minimum number of hours of continual training to ensure that we're up to date with important changes and our knowledge base is maintained. They also have to be indemnified, and by that have the necessary insurance, if you like, so that if a patient does unfortunately get some kind of harm or whatever, they have the scope to be able to seek appropriate compensation. So a registered dentist must, or any member of the profession must, be appropriately indemnified. Of course, what's important is conduct and displaying appropriate professional behavior, what you would expect from a professional, not only in the workplace, in the way in which we communicate and manage our patients, but also outside of the workplace, where some forms of behaviors wouldn't be seen to be appropriate, if you like, for a dental professional who patients put their faith and trust in. And one of the overarching principles in terms of being a dental professional is putting the patient's interests first, doing what is right by them, ensuring you have the right discussions, etc., where the communication side and knowing what the right thing to do is comes into play. So if I could have the next slide, please. So just a little bit about my own career. When I was a dentist, when I first qualified, it was quite normal for certainly my understanding, for there to be two pathways. You're either a specialist and you work, many of these people work in hospital, or you're a general dentist, which is something that you did 9 to 5 or 5.5 days a week, pretty much throughout. And a lot of people still do that. But as I said, things have moved along. I qualified as a dentist from King's in 1996. And I soon realized that the skills that I was given as an undergraduate weren't quite enough, to meet the expectations of today's patients. And I joined as a practice partner shortly after qualifying. But I found that I didn't quite have what I needed to give my patients the absolute best, when at times it isn't always possible to arrange referrals for things. So I took some further postgraduate training, and I went to the full whack end and did an extensive master's program, which I finished in 2005, which gave me the skills to do the sort of treatments that I was interested in, what I wanted to know more about. And you can do postgraduate training to all sorts of levels, be that a weekend course or a diploma or a master's or a PhD or whatever. And these are much more readily available than what they were a long time ago. my advice to any sort of budding dentist is, finish your BDS, get some experience, and then think about what you want to do. After having completed my master's, I was fortunate to be offered a teaching role, which eventually led to a senior teaching position at King's, where currently I'm the Deputy Program Director for the MSc in Aesthetic Dentistry, which, as you might imagine, is quite popular and is, I think, King's most popular postgraduate master's program, where we've got a quite large number of interests, and we've been running for slightly over 10 years now. With that role comes sort of examiner responsibilities, both at postgraduate level and as a BDS finals examiner. I'm also an author, had 2 textbooks published and a number of peer-reviewed publications in the journals. And in the background, I've always had an interest in medico-legal, dental-legal matters. And I joined the General Dental Council as a senior clinical advisor, where I work for them 3 days a week now, together with all my other roles. And my role is primarily with fitness to practice, where we carry out sort of investigations where there may have been a complaint, and then we kind of help filter the process in terms of where the case kind of goes, which is a very interesting and exciting role. Together with all of that, I'm in the process of just finishing my PhD, in my clinical area of expertise is managing worn down teeth, and I'm doing that in the Netherlands. So, in the time that we live in now, dentistry is quite globalized. So as you can probably imagine, yes, for the first decade of my career, I spent working in general practice 5.5 days a week, doing the same thing, seeing the same people, so on and so forth. But it's very different now to what it was then for me, and it is for many people in the profession. So, it's quite an interesting time to be a dentist, where you can steer your career in all sorts of directions, depending on what you enjoy, etc. And I certainly very much enjoy where I am at the moment. If I could have the next slide, please. There we go. So apologies that we started off a little bit late, had